To order the June 7th meeting of Health and Human Services. Before we get started, I will make a motion to allow our Vice Chair Schwarzy in. And I understand member to start also has requested remote, both due to illness. Motion is second. All in favor?
Aye.
Any opposed? Great. They are welcome in. And a roll call, please.
Okay, Chair Renahan.
Here.
Vice Chair Schwarzy.
Here.
Member Selman.
Here.
Member Chaplin.
Here.
Member Desart. And Member LaFrance.
Here. Do we have any public comment?
Public comment? No public comment.
No public comment. All right, so good morning, everyone. Many of you, most of you are on JPS as well, and we had a great update this morning on eviction mediation court program. So I'll provide that. Go ahead, I'll give it to Karen to send around and make sure Mary and everybody receives it, because we've got some really good numbers on great successes with community services, our circuit court, and all the parties. So excellent news. We do have a short agenda today, but we have a major change in our pharmaceutical vendors at the care center, and the way that these are chosen between primary and secondary is a bit interesting. So welcome Donna Weedman, our procurement buyer. I'd like to say a few words when we get to that item. So just want to mention the Care Center Foundation is sponsoring its golf outing at Prairie Landing. So I encourage everyone to attend June 23rd, sign up. It's a great day, it's a fun day, helping our vulnerable residents and our seniors. And I'd also like to recognize Elder Abuse Awareness Day. So the Community Services, Adult Protective Services staff is going to be wearing purple, right? June 15th, 11 a.m. And they're going to share information on spotting neglect and how we can better take care of our seniors. So thank you. Thanks to them for that. And with that, we'll ask for a motion to approve the minutes of May 17th.
Second.
Motion in second. All in favor? Aye. Any opposed? Those pass. Moving on to Care Center requests. I'll take a motion to approve HHS P0188-22, recommendation for approval of a contract for prescription supply for secondary pharmaceuticals for in-house closed shop pharmacy, June 19, 2022 through June 18, 2023, for a total contract not to exceed $60,000. This was bidded.
So moved.
A motion and a second. Donna, do you want to go ahead and kind of give us the whole spiel now on the first?
Sure.
Our online people can see you.
Okay. So we have two contracts that both had exceeded or met rather the maximum renewals, 3 renewals. So that was for primary and secondary pharmacy. So for the primary pharmacy, rather than bidding out, the Care Center asked us to look into, and we did look into and opted to go with a contract for a co-op through MCAP, which is a Minnesota state run organization that approves contracts nationally. So we went with Cardinal Health. Cardinal Health had previously been the provider for primary, and that was the selected contract for the state of Illinois. Our previous source was AmerisourceBergen, and they're selected for other states, but not for Illinois. So we gave them an opportunity to bid for the secondary contract, which they did decline. So the secondary contract, which was bid out, went with prescription supply.
So basically, I mean, I thought it was very interesting. Our secondary pharmaceuticals was a bid out as was required, but the primary we were able to do because through government co-op, and it is a major change, something we've not had. So I just wanted to draw everyone's attention to kind of follow this procurement process.
It is a large value. It's about $2.4 million per year. So, but the Care Centers worked with the transition. I worked with Christine there. We're providing demand history and purchase history to Cardinal, and so far it's going smoothly, and we anticipate that that's going to be cost savings and a good supplier for Care Center.
Okay. Great. Any questions on this item? All right, thanks. All right, all in favor? Aye. Any opposed? Great, that passes. Take a motion. Oh, I'm sorry.
I just wanted to mention, because I've done this in the past, we use a wholesaler. Not all of our pharmaceuticals are available through a wholesaler. So that's why we have a secondary. One, it's if our primary can't get the product, but two, because we can get products through wholesale, which is cheaper. So that's why we have this blend of primary and secondary.
Great, thank you. I'll take a motion to approve HHSP 0189-22, approval of contract to Cardinal Health for purchase of primary pharmaceutical for inpatient outpatient pharmacy for the care center, July 1st, 2022 through June 30th, 2023, not to exceed 2.4 million per MMCAP in use.
Second.
A motion and a second. Questions here? All in favor?
Aye.
Great, that passes. I'll take a motion to approve 2022-55 recommendation for approval of contract purchase order to Medline Industries to furnish and deliver paper and plastic for the care center, July 1st, 2022 through June 30th, 2023, not to exceed 17,000. This is a bid renewal, and I believe this.
So moved. Second.
Motion, and do we have a second?
Yeah, second.
Second, great, thank you. Roll call.
Okay, Member Shepherd,
Aye.
Member Desart, Member LaPlante,
Aye.
Vice Chair Swarzy,
Aye.
Member Selman,
Aye.
and Chair Monahan.
Aye. Thank you, that passes. Take a motion to approve budget transfer at item 7, transferring funds to cover unbudgeted monthly cell phone charges, $1,000 emergency solutions grant for community services.
Second.
Questions? All in favor?
Aye.
Aye.
Any opposed? That passes. Take a motion to approve authorization for overnight travel, authorization supervisor to attend the annual policy and procedures workshop in Springfield, June 21st to the 22nd, 2022,
So moved.
$38.50.
Second.
Motion and a second. All in favor?
Aye.
Any opposed? That passes. This next one, I don't know. Take a motion to approve Community Services Director to go to NACO Board of Directors, Adams County, Colorado, July 20th
So
through the
moved.
25th, 2022, $3,334.50. Motion and a second. All in favor?
Aye.
Any opposed? Mary, thank you for your service. Take a motion to combine informational items 9A, B, and C. These are all received and placed on file items.
Second.
Motion and a second. All in favor?
Aye.
Any opposed? Great, those are combined. I'll take a motion to receive and place on file grant proposal notification 35-22 FY23 supportive housing program, $138,000 for community services. GPN 036-22 homeless prevention program. Illinois Department of Human Services $173,600 community services. And the last item is basically there was a authorization supervisor was approved to go to Champaign for training, but then needed to reschedule. No changes, no price difference. Do I have a motion to receive and place on file those
Second.
items? Motion second, all in favor?
Aye.
Any opposed? Great, thank you. All right, we have a couple, we have two residency waivers today. Yes? Yes.
Yes, good
Janelle,
morning.
take it away.
Good morning.
Morning.
We continue to see a little bit of an uptick in census, so we see these that will come through. There are currently 24 male beds and 39 female beds available at the care center. We've already offered 3 beds to DuPage County residents, so no DuPage County residents would be displaced by these applicants. The first applicant is a 62-year-old. They have lived in DuPage County between 79 and 81, 81, 82, 83, and 01, and then 01 to 06. Mother lives in the county, daughter-in-law works for the care center and knows how wonderful the staff is. Other local family members would be able to visit, as well as growing grandchildren would be able to visit.
Second.
Motion and a second. All in favor?
Aye.
Aye.
Any opposed? Sounds like a good match. Moving on to number 2, thank you.
Yes, the next is an 82-year-old. They have never lived in DuPage County. However, the daughter and family live in Winfield and Wheaton previously. Daughter works for CDH. Son-in-law owns a business in DuPage. Daughter has a friend that works here at the care center and has visited her friend's mother who lives at the care center, giving her experience with DPCC.
All right, great. We have a motion here. Motion and a second. All in favor?
Aye.
Aye.
Any opposed? All right, great. Those are both approved. What great candidates, Janelle, to have people that their very families work in the care center.
Yes. Thank you.
All right, let's move right on to the care center updates.
Sure. We do currently have one unit on quarantine. We were up to as many as 3, so that's decreasing. We'll keep our fingers crossed that we continue to go in that direction. We do have our second booster clinic being offered here at the care center on June 8th, and that is being completed by Jewel Osco. You did mention the golf outing. Before, I wanted to touch on Medicaid rate reform. Is there any questions on those 3 items?
Member Solomon?
For the booster clinic, is that for staff or for patients or for everybody?
It's for staff and residents both.
Awesome, thank you.
Yep. So Medicaid rate reform was under House Bill 246, and so there will be some Medicaid rate reform, which the industry has been really begging for a long time. So it looks positive, and we're currently working with a consultant from Leading Age Illinois that will interpret the impact specific for the care center, as we are a county home, and so our funding is a little different than other facilities that are non-county. So right now it looks to be positive for the care center for our increased Medicaid rate for our residents, but more to come on that specific detail.
Great. Hopefully good news. Hopefully it comes down the pipeline as expected.
Yes, yes. And then the last thing I have is we have our regular meeting tomorrow on the DuPage Care Center renovation project. So we'll be meeting with the architects to go through all the details of the closets, cubic square feet, to ensure our residents will have optimal space in the new form, which is a very big issue for them.
Yeah.
And us, obviously. So thank you.
Any questions for Janelle from the committee? No. All right. Well, thank you very much, Janelle.
Thank you.
All right. Moving on to community services update, Mary Katie.
Good morning. I just have a couple things this morning. As Member Renahan mentioned, we are doing a Facebook Live event for World Elder Abuse Awareness Day on June 15th at 11 o'clock. That will be hosted and run by our own elder abuse staff. Or adult protective services staff. We've started doing Facebook Live events maybe about a year ago, right, Gina? And we've been really happy with the results. You know, not just folks tuning in live, but then obviously they're on our page. And I know our first ombudsman one got over 1,000 views, so we were really pleased with that. Big news on 211, our application to officially be designated as the 211 provider for DuPage County was approved by 211 Illinois. So we're well on our way. We're working through the agreement with Addison and hope to have that wrapped up shortly. We're also still waiting on AT&T to get the timing right for all of the switching that they have to do. So we're really dependent on them before we can really target a by date, but we're working on it. I want to just acknowledge the hard work of the LIHEAP staff this year. LIHEAP wraps up, we have until June 17th to finalize all of our applications. We will have approved well over $6 million in assistance for DuPage residents. Just for some perspective, in 2019, in program years 19 and 20, we were right around 3 million. So we're doing twice as much assistance as we did sort of pre-pandemic. I want to acknowledge Dave, who for the last 2 years, since he started, has really had to dive into this program that he had to learn and now had to double. So he's done a great job. And Carrie Halsall, who is the longtime serving manager of the LIHEAP program, has done a tremendous job. LIHEAP, like many areas of the county, was really struck with being low staffed. Actually, I think it was probably the unit in the department that had the biggest staffing issue. I think last October we had 2 people in LIHEAP, and we should have about 8. And so we have a bunch of new staff who came in, really dove right in. So we're very pleased and confident with the staff we have in LIHEAP now. So, but I just wanted to acknowledge the tremendous work the LIHEAP staff have done. And that's all. And we're sort of heavy into budget season. So stay tuned for our requests for 2023.
Member
Just a
Chapman.
question first. Since you mentioned staffing, so you said you had 2 in line, you should have about 8. Where are you now with
With
staffing?
Live, we're,
So we have a manager and we have 10 staff, but that also includes some that are partially funded through the water assistance program, which is a new program the
right,
state
right,
started.
right.
So they cross over a lot. So technically it's 1 manager and 10 staff currently. So
yeah,
Oh,
we're
but all
fully, yeah,
10 of those staff started after October 1st.
Wow, good.
right. We're fully staffed in Live. Our
Great.
case managers, both in seniors and our housing supports unit, we're down. We continue to be down. I think that's, Nick and I have talked about it. It's sort of an issue, not just for the county, but everywhere you go, folks are understaffed. And so, we continue to work on recruitment and hopefully retaining the folks that we've got.
That's good to know as we head into budget season, because, maybe there's some way we can work throughout our budgets and help you out with that kind of stuff.
Right. Well, about 90% of our staff are grant funded.
Right.
And so there's not, we don't have a lot of positions that are general fund, but we do have some.
Okay, great. Good. Thank you.
Member Selman?
Thank you. And I don't know if this is really a question for you or it might be for Member Schwarzy to when we talk about ETSB tomorrow, but I noticed in July, we're going to be adding a 988 number in Illinois for mental health, which is awesome, but it sort of made me worried. Now you need 3 numbers knocking around in your head. You got to know you call 911 for emergencies, you call 211 for community. Is there any plans for sort of an educational aspect as we're launching these new resources so people don't get kind of confused?
So 988 is a national, that's a national initiative. It's basically a rebranding of the suicide prevention hotlines.
Oh, okay.
So that's answered by the health department.
Okay.
Member Schwarzy might be able to add more to that conversation. Not sure.
Yeah, that's definitely going to be through the health department. It won't be through technically the county board, though we are welcome to offer any advertising or information on that as needed. But it is going to be a little confusing. And I know Mary is planning a big educational rollout when we do get the 211 going, just to make sure people understand what that is. So
Maybe we just ask our PSAPs to keep their ears open after July. If they're getting a lot of confusing calls, we can follow up and see how we can help, especially with it being across all those organizations. But good to know.
For sure.
Thank you, Member Schwarzy.
Gina, do we have the ability to do a warm transfer from, so, and that will continue with 211. So if we get a call with in information referral, someone who is expressing suicidal thoughts, we have the ability to do a warm transfer over to the health department to get them the right properly trained person to take that call.
Okay.
So we'll continue to have that. We'll continue to have that ability. And I think the same with 211, 911 would be.
So even if you call the wrong number, people are trying to help.
Yeah, that's the idea.
Oh, perfect. Good. Thank you.
All right, great. Members, Vice Chair Schwarzy, please.
thank you. A question for Mary. As you mentioned, Madam Chair, we talked about the rental assistance stuff this morning. Mary, where are we at with how much money we've spent on the rental assistance program that we got from ARPA?
Boy, I don't have the number off the top of my head. We're probably somewhere around 35 million of the 50.
Just in DuPage County?
Mhm.
Wow, that's
Yeah.
great. 35 million. Wow. Okay,
Yeah.
great. Thank you.
Okay, I will get that number for you.
All right, thank you. Yeah, I just also wanted to mention, Dave, thank you for your outreach. I know you and Gina work hard to do as much outreach as possible, even though it's hard with having vacancies and things like that. Dave, I was contacted by residents in Willowbrook Corner saying, I'm not sure about the slide heap program. I don't trust. And I talked to both the landlords and some of the people who live over there, and they said they knew Dave. So I was kind of impressed the fact that they knew you. So, thank you. So, any old business? Do you have any new business? I'll take motion to adjourn.
So moved.
Oh, I'm sorry, Member
Sorry,
Vice Chair Schwarzy, please.
Sorry. It's not really new business. I just wanted to pass on to this committee that I will be out of state at our next meeting, so I will not be here, which also means sadly I will miss the golf outing as well. So my apologies in advance.
Okay, so maybe somebody else will win this year. All right, I'll take motion to adjourn.
So moved.
All right, all in favor?
Aye.
All right, great, we're adjourned. Thanks very much.
Yes.